Knock. Hello.
Hi.
My name is Key and I will be your nurse for today.
All
I'm
right.
here to do a head to toe assessment on you. Is that okay?
Yes, that is.
All right. It should take no more than about 10 minutes.
Okay.
All right. Could you tell me your name and date of birth?
Yes, my name is Maria Lopez, March the 29th, 1975.
Okay. And I am double checking against my patient records and all of it matches up.
All right.
All right. Do you know where you are right now?
Yes, I'm in Brightpoint Community Hospital.
Okay. And can you tell me the next upcoming holiday?
It would be Easter.
Okay. And do you know why you were brought here?
Yes, for lower abdominal pains.
Okay. How long have you been experiencing that pain?
For about 3 weeks now.
Okay. I am charting that the patient has had lower abdominal pain for the past 3 weeks.
Okay.
And what is you said the location is the lower abdomen. It's on both sides?
It's mainly like on this side right here.
Okay. Does it ever, could you describe the pain? Does it radiate?
Sometimes it can radiate, but no, it doesn't.
Okay, and how would you describe the pain?
It's like a stabbing, cramping pain.
Okay, do you have anything that aggravates it?
Yes, when I eat.
Okay, and do you have any relieving agents that you use?
Yes, the medication that the doctor prescribed, and then after my food digests, it like go away.
Okay. What are those medications that you use?
I'm not 100% sure how to pronounce it. Something like that. Start with
Is it omeprazole?
Yes, ma'am. Yes, that's
Okay.
correct. That's correct.
All right. Now that I've assessed your pain, I'm going to start with your head first and kind of work down.
Okay.
And then afterwards I do the front side. I will have you turn over to your side to do your back, okay?
Okay, that's fine.
All right. Now I am going to check your eyes. Is it okay if I shine this light in your eyes?
Yes. Do I need to take my glasses
Yes,
off?
please.
All right.
All right, and could you just look straight
Yes.
ahead? All right. Have you had any visual problems lately?
No.
Any changes?
No.
Okay, and how long have you been wearing glasses?
For the last 2 to 4 years, I believe.
Okay, and there's no problems there?
No.
All right, I'm gonna look in your nose.
Okay.
All right. Patient, have you had any discharge, runny nose, bleeding?
No.
Any problems breathing through your nose?
No.
Okay, and can I check your mouth, please? All right, any problems swallowing?
No.
Okay. Patient's eyes are normal bilaterally at about 3 millimeters in size. Mouth is moist and pink. Nostrils are equal in size. Appears to have no drainage or anything. Mind if I check your ears also? Just a personal preference of mine.
Okay.
Have you had any hearing loss or
No.
tinnitus, any ringing in your ears?
No.
Okay. All right. Now I am going to auscultate your heart and your lungs.
Okay.
Is it okay if I raise the bed up a little
No,
bit?
that's fine. Don't put me too high in the air because I'm scared of heights.
Okay, is this good enough?
Yes, you can lift it up some more if you need to, but
Okay.
I just don't want to get up there to the Lord yet.
Okay. All right, and I'm going to listen to your heart first and you just breathe normally.
Okay.
Okay. I'm going to move your cover for a second. Okay. You would listen to the apical pulse for 60 seconds in the real world, but for simulation, it's fine for a few seconds. Patient's heart is regular and rate and rhythm. Okay, now when I move, I'm going to auscultate your lungs, and every
Okay.
time I move the stethoscope, take a deep breath.
Okay.
Patient's lungs are clear throughout all lobes bilaterally. There is no wheezing, crumbling sounds, cracky sounds, or anything. So your heart and your lungs sound fine, which is very good. All of your vital signs are within normal limits, so there's no red flags there.
Okay.
So next I'm going to inspect your stomach and then palpate and listen to it.
Okay.
All right, patient's skin is intact, normal color for race, no scars, lesions, or perfusions. And now I'm going to auscultate. So with this, you can just breathe normally.
Okay.
And normally you would listen for vowel sounds in every quadrant from 3 to 5 minutes. Okay. All right. Everything sounds good. Vowel sounds are normal, active. All right. Now I'm going to palpate. So just let me know when you feel any pain. No pain at all?
No, not at the moment.
Okay, that's good. All right, so now I'm going to check your extremities.
All right.
Skin is nice and brown for a race. There is no skin turgor. Can I see both of your hands, please? Your thumbs.
Okay.
Check your capillary refill. Those are nice and are under 2 seconds. Could you turn both hands over for me? I'm going to check your pulses. Okay, pulses are strong bilaterally. Could you grab my fingers? Okay, that's good. Have you had any pain in your joints? Any weakness?
No.
No troubles getting up in the morning?
No.
Okay, and about your stomach, when was your last bowel movement?
Last night, I believe.
Okay, could you describe it for me, like color, characteristics?
It was soft and it was easy to pass.
Okay, and have you had any urinary problems? No UTIs in the past?
No.
Okay, and how is your diet?
The diet is pretty good. I try to eat fruits and vegetables and like seafood.
Okay. Now I'm going to check your lower extremities. So
Okay.
I'm gonna move the cover if you don't mind. So with the lower extremities, I am checking for edema bilaterally. There is none. I would check the dorsal pedis pulse, which are strong bilaterally. Then capillary refill. Those are under 3 seconds. Okay, could you push against my hands for me? Okay, that's good. Could you lift them up, please? Okay, that is great. And there are no weakness in your knees or anything. Could you lift up your leg for me? Okay, put it back down. Could you do it for the opposite leg? All right, that is good. All right, so now I'm going to ask you to turn on your side. Do you feel comfortable on this side or that side?
I could go on this side if you.
Okay. Now I'm going to listen to the patient's lungs. And every time I move, take deep breaths like we did for the front.
Okay.
Swallowing, breathing, no. Just to listen to your chest. Any shortness of breath, chest pain? Do you smoke? No, ma'am. I'm just gonna listen to your heart first, okay? Okay. Just breathe normal for me.
All right, lungs sound good bilaterally. You can just wait 1 second.
Okay.
I am now checking for the bony prominences, making sure there is no redness or anything. Patient skin is dry, warm to touch, intact. All bony prominences are clear of redness. All right, you can turn over, ma'am. All right, do you have any questions for me?
No, I do not.
All right, so I will document all of this and let your healthcare provider know. I will say about your diet, they might, you said you're already eating a bunch of, is it like, how much fruit are you eating?
I just like grapes, cranberries, and strawberries, and blueberries.
Okay, so a nice variety.
Yeah.
Okay, so they're probably going to put you, keep up with the fruit diet. Do you drink alcohol or use any illicit drugs?
No.
Okay, so yeah, they're probably going to keep you on a fruit diet to kind of balance out the stomach pain.
Okay.
I believe that is all for my bedside assessment, so
Okay.
I'm going to lower the bed. All right, for patient safety, raise up 3 rules. All right, your call light is right there and within reach, and if you need me, I will be right at the nurse's station.
Okay.
All right.